Watch this.
The rollout is rolling, but the questions remain. St. Luke's, the latest healthcare system to offer vaccine boosters. With more shots come more questions, and we're trying to answer them all for you. Well, speaking of healthcare, North Idaho's hospitals are still overwhelmed. A month after being the first facilities to operate under crisis standards of care. That declaration hasn't seemed to help, though, as doctors are warning the end is nowhere in sight. We've changed the way we're doing things here at KTVB. It has to do with mugshots, and it has some of you up in arms. But this change in policy has also gotten the attention of at least one state representative. On the 208, we're all about answering your questions. Seems like COVID is our most popular theme of late. Well, at least for the last year and a half. Well, you're going to stick with that theme. We've seen a lot of questions about COVID vaccine booster shots lately. Like who is eligible, where can you get it, do you need a booster shot for the original vaccines if they weren't effective, or is that what that means, that you need that booster shot because, well, the one you got 6 months ago is waning? Today, Joe Paris spoke with St. Luke's Health to answer your questions and learn more about their new COVID booster program.
As the pandemic wears on, we continue to learn more and more about COVID and vaccines. Now we're learning more about the effectiveness of COVID vaccine immunity 6 months after doses are administered.
So far, our evidence is that it's less effective in preventing infection.
Dr. Jim Souza is the chief physician executive for the St. Luke's Health System. While research shows that vaccine effectiveness does drop off over time, which could lead to a greater risk of infection, Souza explains that vaccines are still incredibly valuable for a large variety of reasons. That cannot be understated.
When you talk about going, however, from infection to hospitalization, and hospitalization to intensive care unit hospitalization, and intensive care unit hospitalization to death, the vaccines are highly effective.
A comparison Dr. Souza uses to explain the vaccine effectiveness is comparing it to using a seatbelt while driving.
Wearing a seatbelt means that even if you get in a car crash, you're highly likely not to die. So too with the vaccines.
The conversation on vaccines is now moving towards booster shots. St. Luke's Health announced that they are now administering Pfizer COVID-19 booster shots for eligible groups. Those include Pfizer vaccine recipients who completed their initial series at least 6 months ago and are 65 years and older, age 18 and over who live in a long-term care setting, 18 and older who have underlying medical conditions, and 18 years or older if you work or live in a high-risk setting. But what if you didn't get a Pfizer vaccine? Can you get the Pfizer booster? Dr. Souza says likely no, but there is one major exception.
We do allow, mixing, if you will, of vaccines, specifically meaning Pfizer after Moderna, for the immunocompromised who are in the highest risk group that we've been offering third vaccines to already.
If you are not in that group but still wanting a Pfizer booster, Dr. Souza has this insight.
If you're not in the immunocompromised group, we're recommending that we see what develops here in the short term relative to Moderna and Johnson & Johnson boosters.
But why not just give everyone a booster now? Dr. Souza says it's partially about resource allocation and realistic impact that boosters will create.
We only want to give an injection and a vaccine when we need to. So we're just trying to match the regimen with the actual need that creates benefit.
Okay, so those that think they need it for the benefit, how do they do this?
So if you're going to go through the St. Luke's Health System, and if that's what you prefer to do, they ask that you go through MyChart or you call them to set up an appointment. Brian, they know that some people will try to walk in, but because of how busy right now, if you walk into St. Luke's for anything, including a flu shot, you could have some long waits, and you could wait so long that you might have to come back the next day. It is important to note St. Luke's is not the only place that you can get the Pfizer COVID booster. St. Alphonsus is also working with the program right now, and there's some other outside of the Treasure Valley systems that are also working on the booster. But there's a lot of questions I know about the vaccines as well as boosters from other companies. Our friends over at the Department of Health and Welfare tell us from the research they're doing and what they're really finding out in the know, Brian, that October is when we're going to find out a lot about the vaccines from the different brands and really how they interact with other brands, as we talked about on the show show yesterday in Europe, for example. They are mixing and matching, so to speak, different vaccine brands. That hasn't been certified for use in the United States right now, but it could be coming. So the research is going on how everything interacts.
And I know a lot of people are concerned that this is going to turn into a series of boosters, but we're still waiting to see how that plays out too.
No plan, is wait and see, but could be possibly like the vaccine that we have for the flu, could be a yearly thing, but we'll find out.
All right. Thank you very much, Joe. Well, it's been about a month since hospitals in North Idaho instituted crisis standards of care. The rest of Idaho followed suit about a week later, but unfortunately they're not looking much better in terms of hospitalizations and deaths up north. Kootenai Health in Coeur d'Alene now seeing record high hospitalizations and ICU admissions due to COVID-19. Here's Katya Stepovic.
The day crisis standards of care went into effect at Kootenai Health, the number of patients hospitalized for COVID-19 was 113. 1 month later, and it has already climbed to 150, the highest the hospital has seen.
150 COVID patients is about 75% of our normal pre-COVID bed capacity for med-surg admissions, right? Today we've got 43 critical care level COVID patients and 17 on ventilators. It continues to amaze me how our clinical staff, our support staff, our physicians, our leaders are able to accommodate this surge.
But one way or another, medical staff continue to buckle down and take care of COVID patients, even the additional 10 to 20 of them that are admitted daily.
We've seen a lot of deaths, averaging about one a day in the COVID population. I just spent the last week in the ICU, and it's a very hard place to work right now. The patients are very sick. It's just a constant struggle to take care of these patients on a daily basis.
The COVID positivity rate at Kootenai Health is 27% and continues to climb. To put that into perspective, St. Al's in Boise's positivity rate is 23%, St. Luke's in Boise, 18%.
It's just incredibly difficult to describe what it's like to take care of these patients and be on the floors and see these patients on a daily basis. The volume is unbelievable. The number of patients that are on the verge of being intubated or in times dying is extraordinary.
Because there is limited availability to transfer patients out of state for care, resources are limited.
If you have a different type of job and you don't have the resources to do your job, it may be a construction site and something doesn't show up and a house can't be built. That's frustrating, no doubt. But when you can't care for a patient because you don't have the right resources, it's a human at the other side.
Staff are endlessly tired and the morale dwindling.
When you come into work every single day, you have a day off or some time off and you come back and you think it's going to be better, and it's not.
And the patients who are fighting for their lives have only lived a small portion of it.
What we've had and we've seen is a really struggle from the respiratory therapists and the nurses, and actually the physicians quite a bit as well, is just being able to wrap your head around the amount of patients that we have lost that are in that younger age group.
I think we're going to see a whole population of young people with chronic lung disease. And many of them will need lung transplants.
As much as medical professionals hate to believe it, for them, the light at the end of the tunnel is faint.
The thing that's frustrating for many of us is that a lot of these people don't need to be in the hospital if they were vaccinated.
All right, Katya, we've heard a lot of these frustrations before from healthcare providers and stuff. But what we didn't hear in that story is how many of these record number of patients in Kootenai Health are vaccinated or not.
Yeah, and there's a reason for that. While they tell me a vast majority of the patients in the hospital are not vaccinated, they can't share a specific percentage with us, and there's a reason for that. Like I said, I want you to look at a statement that Kootenai Health sent to us. They say in part, the reason we aren't sharing this number is because it is manually tracked and too cumbersome for our staff to pull. There was a time when we were sharing this number, but it's not having any impact on changing community behavior and just adding more work for our overburdened staff. So we have stopped providing it. And Brian, if that statement doesn't show you and illustrate just how overwhelmed these medical professionals are, I really don't know what will.
Wow, I mean, it's too hard to keep track and people aren't paying attention to it anyways. It's quite a thing to say. All right, thank you very much, Katya. We take pride here on the 208 and at KTVB in holding our reporting to a higher standard. So we've made some changes to our mugshot policy moving forward. Oh, some of you have noticed, and you've told us how you feel about it, including one of our state representatives. The policy on our text line hasn't changed, though. It's still open and waiting for your questions, your comments, and your complaints about anything or something you've seen on or out in the 208. Text them to this number, 208-321-5614. Just make sure you include your name and the hashtag, the 208.
Ahead for us, what we've learned.
About a week ago, KTVB decided to make known a change to our mugshot policy, saying we'll no longer use them in certain crime stories. Mugshots, those pictures taken of a person accused of a crime when they are being booked into a jail, they're part of public record and would usually accompany crime stories. We'd include that photo of the suspect while explaining why they were arrested, and it would be on air and online. Like a lot of other news organizations, we're changing that. Why? Well, there's been a conversation among those in the industry, within our parent company and within our own KTVB newsroom about whether posting people's arrest pictures is necessary. After all, they're already readily available on most county jail websites. The conversation centered on whether it does more harm than good in certain situations, focusing on what could be that person's lowest point and likely doesn't reflect who they are as a whole. So we decided we would use a mugshot if there is an immediate threat to public safety, to tell the story of a closed case or explain a prior conviction, in a case involving a public figure or an elected official, and in a case KTVB will follow from start to finish instead of just showing you a picture of someone's arrest and then not finding out the outcome of the criminal process. After all, they could be found not guilty. And this sparked a lot of you to comment by way of text message over the last several days. For example, there were some questioning our religious affiliation and calling our policy too soft-hearted for the criminals, since after all, they chose to do the crime. Sure, don't want to offend the robbers, the muggers, the rapists, and the murderers, right? It's unacceptable, you said. Therefore, they are now offended by our policy and they will choose not to watch our station. Then, of course, there's the accusations of virtue signaling that we made this decision to show or to avoid showing persons of color as criminals. That's why we decided to do this. Well, do you know the percentage of people arrested and booked in the Ada County Jail over the last 3 years? What percentage of them are white? 85%. So this isn't that. And of course, others were supportive, like foster parents who don't want the kids they care for to find their parents at their worst moments. Others called it a great show of respect and humanity and thanked us for doing so. Well, one of those who reached out was State Representative Brooke Green of Boise. She was in favor of our new mugshot policy for a very personal reason. In the summer of 2019, Jessica Harrison was arrested and charged with 2 misdemeanors. Not usually a big deal, at least not usually newsworthy, except Jessica, at the time, was the executive director of the Association of Idaho Cities, which is kind of a big deal in government circles. So it made the news, mugshot and all. KTVB chose to not cover the story back then, but according to Representative Green, her friend was in the middle of a mental crisis at the time, and making the news made things worse.
When you lose somebody to suicide or they take their life, you can't, there's no explanation.
Representative Brooke Green says she first met Jessica Harrison in college, and instantly they became best friends. A friendship that ended nearly 2 years ago.
2 years this November, and it doesn't ever get easy.
What was easy, she says, was noticing when Jessica needed help.
It was June of 2019 that I first recognized that Jessica was sick. As the days went by, it was clear that she was very manic and that she was having a mental break.
Representative Green says Jessica began acting out in public, failing to show up for weekend getaways.
And there were reports of her running up and down the street at night naked. I walked in at one point and she was sitting in the living room and she was just vacuuming one spot for like 10 minutes. We tried everything from getting her committed into hospital, and she fought that because she'd have moments of lucidity, and then she'd slip out, and it was constantly trying to address it. Amongst all the friends, we said the only thing that's going to get her help is if she gets arrested. And sure enough, she gets arrested up in Idaho City. And they arrested her and brought her to the jail, booked her into Ada County Sheriff's, put her on a hold, and then transferred her to the hospital. Well, in that period of time, her mugshot is taken and it is released. I remember seeing the mugshot that day, and it was kind of two parts, right? Finally, relief that we know she's somewhere safe and that she can get help, but also understanding at that point that her career is over. And we all knew it. And I remember looking at that going, she's not going to recover from this. And I knew at that point, recovering from having her mugshot present and plastered in 6 media channels and having her career associated with it, that was going to be probably one of the most impactful moments in her life. At that point, she came out of the hospital about a week later, and then she lost her job about a month later, and then that November she took her life. And we all knew we knew that the outcome when her mugshot hit, that was a potential.
I mean, that mugshot, knowing that everybody sees you at your low point.
Yeah. It's taking somebody's worst moment likely in their life and making it somebody else's entertainment. And we've now taken their mugshot, plastered it on there and said, we're going to stigmatize whatever occurred, oftentimes in some cases a mental health issue, and we've really just plastered that on their forehead.
It was during that upcoming legislative session, Representative Green considered drafting a bill that would limit the release of mugshots. So she sought the counsel of some of Idaho's media members. But reminded mugshots are part of the public record, Representative Green let it go. But not completely.
And it's not.
She still thinks, for those arrested and in the middle of a mental crisis, maybe delay the release of their booking photos.
We should afford them the opportunity to seek treatment without stigmatizing their illness and plastering it all over the news. And then in the conclusion of their program, then they can evaluate the release of the mugshot.
So simple delay, you think,
Yep.
in that is going to be enough to do that?
I would like to see a delay of the release to allow and afford a person who is arrested, who faces these charges, who actually go through the process, a delay for them to go get their assistance. In Jessica's case, if she had been afforded the opportunity to privately go through her illness and afforded the opportunity to seek clinical help, maybe she would be with us today. I don't know. But what I do know is that we use the criminal system too much for people to access help. And so once they actually get access to that help, we really should not stigmatize them because of it. Had she had the privacy to get the help she needed, maybe our outcome would have been different and I'd still have my best friends.
Representative Green says this delay would help those arrested and put on a mental hold, especially if they go through the criminal process and the charges end up being dropped because it's clearly the result of a mental illness. By then, she says, the mugshot should never be made part of the public record. She says that's exactly what happened in Jessica's case. Her charges were eventually dropped. Ada County Sheriff's Office already doesn't take pictures of those on a mental hold. As for the policy of using mugshots of public figures, Representative Green is worried that judgment call that news agencies make is too arbitrary. What constitutes a public figure, she asked. A one-time Teacher of the Year? Representative Green says she would rather find a solution to this issue by working with media instead of going through the State House. And just a reminder, if you or someone you know are going through a tough time, a mental crisis right now, and are considering thoughts of suicide, please do not hesitate to call the number on your screen for the suicide hotline. Between the sizzling sunshine of summer and the wet, windy winters, autumn slowly sneaks into the Treasure Valley. And with it, the City of Trees takes on a whole new hue. Amidst all the changing leaves, we want to share the beauty you caught on film before they fly away. Well, don't you fly away just yet. Still got a lot of show left. Can't leave before you send in a text either. 208-321-5614. What's caught your attention today? Tell us about it. Make sure you add your name and the hashtag #the208. And stick around. We might share yours at the end of the show. All right, final moments of the show here. And Vicki wants to know that, well, first of all, she truly appreciates the show, but thanks for the coverage of the pandemic. But when you show empty beds during it, it seems contradictory. Well, we can't just get access to a hospital and into a place where people are in bed, because that would violate HIPAA rules. And we just can't go walking into a ward with COVID patients without any sort of reason and direction. So sometimes that's all we're left with. We apologize. Good job of the interview with Representative Green. Mental health is a real issue in Idaho, and every family, even mine, has been affected by suicide, says Mike in Caldwell. Sorry to hear that, Mike. Brian, thank you for your time with Representative Green. I did not know until precisely, well, during that interview, how much I needed to learn the value of mugshot sensitivity. Yeah, it's something that we've considered for a long time here, and we just kind of made the move recently to do that. But we're going to take it on a case-by-case basis, but at least we have the ground rules set up for you. We'll see you tomorrow.